I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap
Afternoon.
my hands, turn
It
around
feels
now
like we
and
got
dance,
here
dance,
just
dance.
now.
I just wanna have
Time
fun,
flies
clap
when
my
you're here,
hands,
hey?
turn around now
My
and
name is
dance, dance,
Tahila,
dance.
and I'd love to share with you a little bit about my journey with hyperpigmentation, and then we're going to go a bit into questions with Dr. Alice. So, I share a lot of my journey on social media, behind a camera, by the way. So, you'll have to forgive me if I stumble a little. It's been a while since I've sat in front of so many people. Um, but ultimately, I grew up with acne. And as a teenager, I think a lot of us have it. And you're often told by your parents or family members that you'll grow out of it. And when I hit my 20s and I still had acne, my confidence took such a massive hit. And it was never because of the acne itself, but it was because of this idea of permanence and hopelessness. You kind of feel like, what do I do? It's there forever. And because of that feeling, I ended up hiding it a lot. And I wore makeup not because I wanted to, but because I felt like I couldn't show my scars, I couldn't show my marks. And I'm sorry, this topic makes me very emotional. Um, Once I started doing skincare, that is where it took a turn for me because it never felt permanent anymore. Seeing those little improvements in my skin every day, every month, made me realize that I don't have to hide anymore. I could be open about it, knowing that it's not forever. And I hope that for some of you that you can experience that through skincare. And my experience has been with Roche-Posay, and they are so close to my heart. Because of them, I was able to stop wearing makeup. Well, not stop wearing makeup. I still love it. It's a form of expression. But I didn't wear it because I felt like I had to. I wear it now because I want to. And yeah, I want to share with you guys a bit more about hyperpigmentation, what it means, and get a better understanding of how you can treat it. So I'm going to start with Dr. Alice. Could you please give us a clear explanation on what hyperpigmentation is?
Of course, Tahila. Hello, everyone. My name is Alice. I'm a dermatologist. I've got 4 little boys. Power to all of us ladies sitting here looking after our skin. I think it's such an important thing. So if we talk about hyperpigmentation, what does it mean? And quite literally, it means an increase in the pigmentation in your skin. Now, all of us have in our skin normal skin cells. Those are called keratinocytes. And then sitting within them are little cells called melanocytes. And melanocytes are the ones that make pigment. Now, every single person, no matter your skin tone, where you come from, has the same number of melanocytes, but the color of your skin is denoted by how much pigment they produce. And in certain times, they become overactive and they produce more pigment. So when we talk about pigmentation, I think a very important thing, hyperpigmentation just means there's an increase in the pigment. And what we really want to know is why. What is the cause? And if you want to do that, you can look at different ways of dividing it. But if we look at the causes, maybe the 2 main ones that we see very commonly are something called melasma, which I think a lot of you will be familiar with, and then something called post-inflammatory hyperpigmentation, which means the pigment that is increased due to any previous insult to the skin. And that can be what Tahila's talking about in the case of acne. That can even be from things like eczema. Melasma, if we're talking about melasma, so I think if you talk about acne and melasma, that'll cover a huge percentage of women's hyperpigmentation. Melasma is a condition where the skin is producing increased pigment, seen much more commonly in women, although it can present in men. And there are really 3 main factors there. The first is genetics. If you have got a family history of melasma, you're far more likely to have it. We're far more likely to see it in patients that naturally have a more pigmented skin. The other thing is the sun. So we see it most prevalently in places with a high UV index, of which South Africa is definitely one. And the last one is hormonal factors. So in patients like that, we'll often say, have you recently started an oral contraceptive pill? Are you pregnant? There are factors like that. So I think if you want to treat your hyperpigmentation, maybe there is huge value in first understanding, why am I getting this pigmentation? Because obviously, if there is a cause, and as Tahila is saying, acne, if you don't match the acne itself, no matter how hard you try and treat the pigmentation, being formed. Value always in knowing what is causing this hyperpigmentation, and therefore how can I try and treat it.
Right. I do think you covered some of the what I'm about to ask you, but what are some of the key contributing factors to hyperpigmentation that people should be aware of?
So I think sun, if I can say anything, it's the sun. And I think when you live in a place like South Africa, like we do, to really understand how to protect yourself from the sun is quite difficult. Actually, it's quite a challenge. And if you're ever going to embark on looking after your skin, that understanding is just critical because our sun is incredibly harsh. And often things that you do to help your sun, retinoids are an example, sensitize you more. So if you haven't remembered or learned how to protect yourself from the sun, you will not succeed in the things that you're trying to benefit. So things like staying out of the sun between an 11 4, always having protective mechanisms like a hat, long sleeve, wearing sun cream, those things all make a big difference. So I think, Tahila, can you remind me of the full question so I make sure I'm answering you properly?
The question is, what are some of the key contributing factors or causes of hyperpigmentation that people should be aware of?
Okay, so the sun, we said that.
Yes.
Hormones, to be aware of that. And I'm not saying everyone must stop their oral contraceptive pill, but be aware that if you've had a dramatic increase in your pigmentation, that may be a contributing factor. Maybe you can look at a different one. Your genetics do play a role, so that's important to know that you mustn't think there's something completely abnormal. If you have a family predisposition to it, you also do. And then I think just to be aware if there are inflammatory conditions that are creating that inflammation in your skin. And obviously, if you have things like that, like acne, there are conditions like lichen planus, pigmentosis, you would need to treat those in your ambition when you're trying to treat your pigmentation.
No, I can definitely speak to that because I used to treat my hyperpigmentation and I'd start to see it fading, but I never used sunscreen. And I was so frustrated because I was like, why is it not going away? It's getting better and then it comes back. So yeah, the importance of sunscreen, I think, is the thing I preach the most about today. Please, 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 if there's anything you do, wear sunscreen. Um, to move on, how can we effectively treat hyperpigmentation both professionally and at home?
All right. So this one, I was actually telling Tahila, whenever I go to dermatology congresses, if there's a lecture on melasma or hyperpigmentation, it is packed. It's just as packed as this room. Because even for us as dermatologists, this is something that's tricky. So I think the first thing you want to say is understand that treating hyperpigmentation is not one of those very lucky conditions where you can take an antibiotic for 3 days and then your throat is cured and you never have to worry about it again. It's a journey. There will be things along the way that will flare it again. If you don't maintain it, chances are it will come back. And you must understand that. And I suppose as a doctor, that's a frustrating thing. For your patients, you want to be able to say, I'm going to take this for 5 days and you'll be sorted. But it's not like that. So it's a long-standing journey, and you absolutely want to know that you are treating correctly the cause, because if you don't identify the cause. So then let's talk about melasma or post-inflammatory hyperpigmentation from acne, and we're assuming that we've treated the acne. The first thing to do is the sun protection and the sunblock, and I've spoken to you a little bit about that. And as Tahila is confirming, that cannot be overemphasized. It's not a small thing on the edge, that is critical. The second thing is you think of topical things that can help you. So the traditional things that we as dermatologists, I like to give my patients things that we know are good for your skin in general and that actually are powerful tools in preventing aging, pigmentation, fine lines. So all of my patients will I advise them to use a vitamin C serum in the morning. So there is huge evidence for vitamin C in lightening pigmentation, but it also protects you from the UV radiation from the sun, from the oxidative stress. So every patient should be in the morning, you wash your face and you should put a vitamin C serum on. The skin is something where we're lucky that we have such access to it just to put things on topically, as opposed to your heart or your liver. I mean, it's not that easy to target them. Then there's huge value, and you will probably all be aware of this, in a retinoid at night. So vitamin A, and obviously you would know of it in the form for acne, Roaccutane, but a topical vitamin A has huge benefit in terms of lightening pigmentation, but it's far more than that. So what I like is that you can put it on your whole face, and that also targets pigmentation. It reduces fine lines, it stimulates collagen. So for me, sunblock, vitamin C, vitamin A, every single patient, I tell that. And then once you've done that, you think about, are there specific targeted at-home treatments that you can use? And that's where we come to our topical lightening agents. So traditionally, as dermatologists, the one that we've always advocated and I still use is hydroquinone, which is a powerful topical bleaching agent. There are caveats and things to consider with hydroquinone. It's something that doctors will prescribe for you. And I suppose one important one is that overuse can actually cause something called exogenous ochronosis, which is a very scary thing where you get permanent pigment that gets laid down in the skin that you cannot treat. So traditionally, if we use that, we use it for 3 months and then we have something else in the resting phase. But there are other wonderful anti-pigment agents that you can use. And one example is this new Melasil from Roche-Posay. There are other rival companies that have other products that are topical lightening agents that work locally to decrease that pigment that's sitting in the skin. Something like hydroquinone has things that are concerning, and the one is, as I said, the side effect of the exogenous ochronosis. The other thing that is, it can be quite irritating when you put it on. So if you are frightened that your patient might have post-inflammatory change from something inflammatory, you might be concerned it might make it worse. And again, that's the nicer thing about some of these other products that you can buy, like Melasil, or other products houses also have them where they don't irritate the skin. And the other thing with some things like hydroquinone is that if you use them on normal skin, it will also bleach normal skin. So that becomes quite tricky as a patient to apply it, particularly when it's focal areas after acne that you're trying to dot it on. Whereas products like Melasil, you can actually put it on your full face, which is wonderful, and it won't lighten the normal skin.
Wonderful.
And then obviously, sorry, Tahila,
No,
there
no.
are other physical modalities that one can use. And again, here you really have to be very careful because whatever you're doing physically can cause inflammation and can worsen pigmentation. So that's when I think going to a reputable person who knows what they're talking to has huge value. Obviously, we have things like laser, a Fraxel laser that might help your topical treatments work, and peels, salicylic acid peels or alpha hydroxy acid peels that strip that layer of skin where the pigment is. So it's quite a complicated process and quite a journey, but I suppose the sunblock, vitamin C, vitamin A, and then a topical lightening thing remain throughout.
Yeah, I'd love to highlight something, or elaborate on something you highlighted. That's consistency, and I think I get asked a lot. People will try a product, and then after a couple of weeks, they say, "Oh, I haven't seen results," and they kind of give up. And I get asked a lot, how do you feel confident with these marks, or with your acne? And it's from the consistency. The consistency allows you to see. Sorry, don't know what's going on there. It allows you to see improvements, and in those improvements, I found confidence, and I feel like it's so important. I'm so sorry, guys. The All right, it's done. If you don't allow yourself the chance, and if you don't do it consistently, I feel like that is where people lose hope. And I feel like you should allow yourself the chance to see results. But I want to highlight again, my favorite product, which has helped me see results, is Mela B3. And I'm hoping Dr. Alice can elaborate on Mela B3 because the active ingredient is Melasil. And I'd love for you to explain to us what exactly is Melasil.
So basically, it's amazing what Melasil does is there's this quite a complicated pathway within those little melanocytes of how melanin pigment gets laid down, and it starts with tyrosine and it goes through different enzymes. But basically, what is quite special about Mela B is that it mops up or destroys these DHI, DHICA, and dopaquinone, these melanin precursors. So before they even become pigment, Melasil is working to block them. So it stops in that cascade, and therefore you can use it comfortably on the normal skin, and it helps to mop up and prevent the pigmentation that is there.
So it helps treat active post-inflammatory hyperpigmentation while also preventing future
Exactly.
post-inflammatory hyperpigmentation.
And without not damaging or lightening the normal skin, because that can be a little bit futile. If everything lightens together, then the darker bit stays darker than the surrounding skin.
All right. So I want to ask you this again. Why should I use sunscreen if I have a pigmentary disorder, specifically if I have pigmentation on my face or my skin?
I think what we've said is that in every pigmentary disorder, the sun is what is driving that response of producing more pigment. So whatever it is, whether it's inflammation, whether it's melasma, the sun is a key driving force. So it is vital that as part, in fact, so much so that if that was all you did, if you just said, all I'm going to do now is be meticulous about my sun cream, chances are within a few months you would notice your pigmentation was better. It's that powerful. And I think importantly that other things that you're doing, for example, of vitamin A, which I think is such a wonderful tool in lightening pigmentation and aging, but it does sensitize your skin more to the sun. So that's another reason why that sun protection is so critical. And you'll notice I say sun protection. So when I go to Clifton and I see people putting sun cream on and then lying in the sun like a little turkey at midday, that gives me anxiety because you still are there in the sun. So it means sun protection, which means 11 to 4, be aware that you should be sitting without your hat on, and it means wearing the protective clothes, and it means sunblock, especially in South Africa, because our sun is not the same as in Norway or Alaska. We have a high UV index. We have significant UV exposure here.
So we've spoken about Mela B3 and we've spoken about sunscreen, but together they make a power duo. Together they make a power duo, and I want to talk a little bit about how using them together, how does that actively treat hyperpigmentation? Why is that the best solution in this scenario?
So I think we're saying that number one, you want to stop the sun as a driving force and factor, and then you want to also do something active to actually target the existing pigmentation. So for La Roche-Posay, this offering is a very powerful thing of not only the targeted skin lightening treatment that you can put on twice a day, as well as your sunblock. And their sunblock, actually, they have a new sunblock which specifically targets dark marks because it's got a new ingredient called Mexerol, which also aids in dark spot prevention. When you're looking at sunblock for pigmentation, our guidelines in South Africa say if you want to do a blanket rule, it should always be at least an SPF 50. And then you want to look at it being UVA protective, but you also want it to have, so UVA and UVB, I think we're all fairly comfortable with, but very important for pigmentation is visible light. We want to include visible light protection as well. So that's very important and and so these sunblocks that are targeted for pigmentary disorders include those extra protection for visible light that then enhance your protection against the sun, and the Mexerol and the Mela B within this dark spot corrector also aid in that.
Would you say it wouldn't be worthwhile using just one or the other? In terms of like, remember I mentioned that I used to just treat my hyperpigmentation and never really saw any results. Would you say that sunscreen is arguably the most important part?
I would. Tahila, for me, absolutely. In fact, if you could only do one thing, you would want to treat the cause. So I think that would be important. So with the acne, you obviously, if you're having ongoing acne, you will keep getting post-inflammatory. So treat the cause and sunblock. It will just take time, and that can be a bit frustrating. But I think you're absolutely right in saying there's almost no point in doing the other things without the sunblock.
So we've spoken a lot and there's a lot of science, and I imagine some of you have questions. So there is a mic floating around. If anybody has any questions for Doctor, just raise a hand. We have one here in front.
Thank you for the class. I just wanted to ask, when do you decide to see a dermatologist? So when do you decide that, topical over-the-counter stuff is just not working and it's time to see a dermatologist for hyperpigmentation or any skin condition?
I think that it's such an interesting question, and probably applies to so many more conditions than hyperpigmentation. I think that if you say, the one thing I don't like is scarring so much. So I think for us as dermatologists, if we ever see scarring, now post-inflammatory hyperpigmentation is different because we know that does resolve. But if you're starting to see scarring, then I think that should be a trigger to say, this I'm worried about, because often we're not so good at treating scarring as we are at preventing it. And then maybe to try and be a little bit academic in how you approach it and say, right, look, I think La Roche-Posay are outstanding. I think if you go to Dis-Chem or Clicks and you choose the big brands that are backed by science. So, I mean, it's a La Roche-Posay event, and I'm a huge advocate of La Roche-Posay, but Eucerin, Cetaphil, you choose a brand that is these smaller brands, that's a bit tricky. But if it's backed by science and you say, I'm going to do 3 months of what this brand says would be the optimal at-home use, non-prescription medication, and I'm going to almost be a bit scientific about it, take pictures, do it for 3 months, and if you still feel you're not winning, the thing is, I think it's a very scary space because there are so many products available. It's so incredibly overwhelming, and I think you end up spending so much more. And for us, sometimes it's such an easy thing to look at a patient and instantly know, but this script, which will cost nothing, like all the money you've spent, will sort it out, immediately. So I think it's a very overwhelming thing for a patient. But I would say, if you say, right, I'm going to do the best that I can for 3 months, and then if I'm not happy, maybe I need prescription medication. Because ultimately, often, if you can buy it over the shelf, it means it's safe enough that anyone could use it, which can sometimes mean it's not as effective as something that it can be prescribed to you. So I think instead of spending a fortune, maybe once off seeing it, just to get advice, and at least this is the cause and you have got good advice, but maybe to do it that way. Do we have any other questions? It's very difficult to see you all because we're looking into the lights, but...
Hi there. Thank you so much for the masterclass. There was a section that you covered on post-inflammatory hyperpigmentation from acne specifically, and you mentioned that sunscreen, topical products like a vitamin C serum daily, and then retinoids at night would be helpful. What is your advice for someone who's never used retinoids before? Like, where would you begin? Because I know sunscreen, I know vitamin C serum. I've never used retinoids before. How would I go about starting that process? How would you advise what the best way would be for that to happen?
This is a very good question. And I think I always say to my patients, you want your skin to love retinol because it's so good for your skin. So I've got, for example, I've got eczema, I've got a very sensitive skin, I've got a bit of rosacea. So retinol for me, retinol can be something that can be very tricky, and you really do need to let your skin get used to it and try it. So I'll tell you what I'm telling my patients at the moment, and I suppose it's appropriate that I'm sitting here because I'm not. I actually love, if you go to Dis-Chem or Clicks, for example, CeraVe have a retinol serum in their acne range, which is one that you can buy on the shelf. It is gentle, it's got ceramides, but it is a retinol. And if you try and start with the gentlest retinol, so that's the first point, is start with the gentlest retinol you can find. If you look at Clicks or Dis-Chem, I think you can trust those scientific brands, and you start there and you start it once a week. So you do it at night, you would wash your face, put your retinol on, and moisturize afterwards. When we use a retinol, it's almost like a chemical exfoliant. So its effect is that it dries your skin and makes it a bit red. It's not a side effect, it's how it's working. And do it once a week and see how your skin is. And then every 2 weeks, you can build that up. So you can then do it twice a week and do that for 2 weeks. And then what I normally say is when you've finished it, so aim to get to sort of every second night. Some patients' skin tolerates it beautifully. They can use it every night. That's wonderful. Even if you're using it 3 times a week for aging, or it will still be having benefit. And then what I'd say is when you've finished your most gentle one, when it runs out, evaluate how your skin is tolerating it. And if you feel actually my skin is tolerating this beautifully, then you can step up to a higher grade. Obviously, if you see a doctor or dermatologist, we can give you prescription retinoids, which what we use for acne as a first-line treatment. And that's not wrong to be using that as your anti-aging cream. But if you want to, you can build up by using the gentler ones till you get to the prescription retinoids. I always say Dermastore as well. You can trust all of those, because I think that's the difficulty, is that there's so much on offer. I think if you Dermastore's vetted the products there, you can. So if you look there at a price point you're comfortable with and a percentage that you're comfortable with.
Questions? Nope. Here we go.
Hi, thanks for this class. It's very, very informative. I had acne for a very long time, and it took me about nearly a year and a half to clear my acne. And I've
So
been-
sorry, I can't hear.
It took me nearly a year and a half to clear my acne. I've been suffering for very long, so I was on oral meds, everything you just mentioned. But I finally my skin's clear, and I use CeraVe and La Roche and Cetaphil. Absolutely amazing. What I do want to know is there any benefit in taking glutathione coupled with everything else, and of course the sunscreen, for pigmentation specifically?
Yes, I think there's not enough evidence that it's miraculously good. So I would say you can probably spend your money better elsewhere, would be the short answer to that question.
Hi. So I just wanted to find out when. Can you hear me?
I can't see you. I feel like a mole. There you are. Thank you.
Okay, so I just wanted to find out, when it comes to hyperpigmentation, how do you find a product that doesn't necessarily bleach your skin but brightens the hyperpigmentation or brightens the dark marks? How can you identify the differences?
So that's a very good question. And I think that the ones that are by reputable brands, I think the catch is if you don't know where it comes from, or as dermatologists, we get very upset by miracle creams that come from a non-trusted place, and they often contain very powerful, dangerous ingredients, but they're just not acknowledging it. So I think the best thing is to say, if you trust things, so Melasil, for example, the ones that really bleach the skin is mainly hydroquinone. That's the one that you need a prescription for. The others that you can apply to your whole face, and if you can buy it at Dis-Chem or Clicks, you can trust that it's not going to bleach the rest of your skin. That makes sense.
Hi. So, this side.
Thank you.
This is a follow-up question to your previous question on retinol. I wanted to find out, so I've been using retinol for about 3 years now, and I'm looking to go to a higher dosage. But I wanted to, because you obviously mentioned that you can either speak to a dermatologist for them to recommend one, or if they're store-bought one. So I guess I wanted to find out if you have any brand recommendations that sort of have high volume ones. And also, I don't know if you recently saw in the EU, they've limited the use of retinol to only 0.5, and everything that's over that you can't really use. And there were some brands that were claiming to have higher dosages that are actually on shelf, which sort of proves that they weren't giving the correct amounts. I also wanted to find out if you have any brands that you could recommend that you believe are actually trustworthy in the amounts that they give. There.
Sure. So I think maybe my answer about the brands is if you Dermastore for me is a very good litmus test of those brands. You can trust those brands. If you can buy it on Dermastore, it still can't be medical grade. I think the only over-the-counter one that you can get is Differin, adapalene, which is about 0.25% of adapalene you can get over-the-counter at some pharmacies. But generally, the percentage is lower, and I think if you in a store, you can trust those brands, and those are effective. That's vetted by a dermatologist, so he checks everything. So I would go for those. I can't speak to the other ones. Those would be the ones that I would recommend.
Questions? Here we go.
I can see you. You're wearing.
Hi, I just want to know, glycolic acid and niacinamide together is apparently good for the hyperpigmentation as well. Just wanted to confirm that.
Yes, definitely. So those are definitely ingredients that sit there as exfoliants, and definitely niacinamide anti-inflammatory, but definitely can have a role. They definitely have a role.
Any more questions? We good? Okay, we're good. You done? No, you can complete.
All right. I think I just like to end off by highlighting, I don't think I spoke about it enough, is the Power Zero protocol and why it's so important to use both. Because yes, I use Mela V3 and I've been using it for over a year now, and I've seen such a big improvement in my hyperpigmentation. But if I did not use sunscreen, which I didn't for the first few months, you won't see the results that you want. So if you want the best results, I highly recommend trying both products together. But yeah, thank you, Dr. Alice, for such an informative talk. There was a lot of science and I definitely learned some new things. Yeah, thank you.
Thank you so much for such an informative
I
class.
just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance.